So imagine what you have envisioned for the future is actually already the reality today. Burdith, Raquel, and I, Becca, will be taking you on a journey to explore augmented and virtual reality in medicine today and what's in store for this technology in the future. First, it is important to understand the difference between Sorry. Oh, there we go. No,
I think you went too far.
I did. The difference between augmented and virtual reality. So the technology used is very similar, but there are differences. The technology in augmented, you are in a real world setting with a virtual aspect. So for example, Pokemon Go allows you to walk around in real time, use your phone to project a virtual element into the real world, and you play the game through that. It's completely controlled by the user and can be accessed with smartphones. And sometimes, in some cases, you'll wear like headsets or glasses, but you're still just enhancing the real world with a virtual aspect. As for virtual reality, you are completely immersed in a fictional reality, in a virtual reality. And because of that, you're being controlled by the fictional system that you are immersed in. And this also requires a headset to block out the actual real world around you.
Sorry.
You know,
Do you want me to just
instead
swap
of bottom, go with
the mouse?
the berries. About. Who has the?
I have the mouse, it's just not letting me click it. There we go. All right, so the pros and cons of this technology. The pros, there are a lot right now because we are trying to convince and persuade people into adapting these into what we have already. One, it is both enjoyable and engaging for those who are using it. This goes with the traditional reading and watching videos that can bore some students. So this makes it engaging, which helps you learn better. So you're also being educated from the system. So it reduces the stress on the educator to have to sit there and explain over and over. They can do that on their own with the help of the system teaching them. These also you can make worry-free mistakes in the system they'll give you analysis of what these mistakes were. You can learn from your mistakes. You can make as many as you want because you're not actually doing these on real life people or messing up medical supplies, which cost money. So it is in turn an investment. And you're also practicing that muscle memory. So you're engaging your cerebellum to remember the steps and build your confidence to be able to perform these in a real world setting. The cons, on the other hand, are technology can be expensive. So you have to take into account the cost of implementation and the hardware compatibility with what you already have, installing new data. And then you also have to educate the educators on how to use this technology, which will lead to a little bit of pushback from the current educators who sometimes barely even know the technology they're already using today. What we don't know too much about is overuse complications. What we do know right now with video games and stuff like that, they're very engaging. They make the person using them very excited. So you have the risk of them overusing these and taking advantage of this technology. And what we also don't know is there's potential eye strain, especially with the VR headset that's always in front of your face. But we will know more about this as it's being used. There we go. All right, now we'll go into the different types of technology that are currently being used. One is Microsoft's Hollow Anatomy. It is a type of augmented technology that is used for learning anatomy of different systems. So you can call it the skeletal system and muscular system, and even the small stuff you haven't been able to see, like in cadavers and in physical models, like the lymphatic system. What's really cool about this is the peer interaction aspect is everyone can put their little headset on and see the same image in front of them at the same place. So you can have other students in there at the same time pointing out like this bone and that bone. And everybody will see that interaction because it is still an augmented. This technology was actually founded in 2016 and is currently in use in some medical schools right now. Next, we have the coolest thing in the entire world. It is X-ray vision. It's Augmented X vision. So you wear a little headset, but doesn't completely obstruct your view. This isn't just used for educational purposes. This is in the works of being actually used in surgery. So the example here is he's doing spinal surgery. And what these two little lenses here do is they project like a 3D aspect of through the skin and through the muscles of the vertebrae in this example, giving a better placement of where to do incisions or insert, in this case, the screw into the spine. This technology was founded in 2014, so it's still in the works. And what they found since then is using this during actual surgery or surgery on cadavers has proven a 98.9% overall placement accuracy, which is pretty hard to beat on your own. Next, I will pass it on to Raquel to talk about the virtual reality aspects. Raquel, if you're talking, you're muted.
No, I wasn't. My computer is freezing up. Do you guys see me now?
Yes.
Okay, thank you. Okay, so thank you again, Becca. Now that we have covered the augmented reality technologies, I will go ahead and discuss the virtual reality technologies that are being used today. So the first two technologies I'll be discussing with you guys are the OSO VR and the fundamental VR. So let's go ahead and start with the OSO VR. So this is the leading virtual reality surgical training and assessment platform that gives medical device companies and healthcare professionals radically better ways to share, practice, and learn new skills and procedures. So these can range from anywhere from really rare routines to also the most simple or complex. And then as you can see, these consist of a headset and gloves, and that's shown right here at the bottom right. I know I'm covering that screen, but you'll be able to see that later towards the end when we look back at photos if necessary. Then the second one we have is the fundamental VR. So fundamental surgery is a haptic VR or a sensory-based multi-mode virtual reality education platforms for surgeons as well. This technology delivers immersive simulations and then underpinned with haptics. So again, this has to do with touch, and these interactions enable full rehearsal of medical and surgical procedures, which also provide deep data insight into competency and skills development. And then again, these usually consist of a headset and controllers as pictured here on the bottom left photo. And of course, they could simply be used with one's hands as depicted here in the top photo. And then what we see with these two virtual realities thus far is that there have been significantly higher performance scores than those using traditional training. They've also been subjectively rated higher compared with reading and video methods, since it is a hands-on. And so one is able to fully immerse themselves into the training, and contain high fidelity modules that cover over 100 different specialty areas. Some include orthopedics, spine, and interventional cardiology, for example. And it is affordable. So in comparison to having to train or live train a surgeon, which could range anywhere from $50,000 to $400,000. This system is just $10,000, and I know that's still high, but again, in comparison, it is more affordable and it is scalable. Thank you. So the next two technologies that I'll be discussing is Health Scholars and SimX. So let's go ahead and look at Health Scholars first. So Health Scholars is the leading cloud-based virtual reality clinical training platform. So cloud-based, just for any of those who have an iPhone, it is similar to the cloud app where you could store a lot of memory on there. It is IT friendly and securely accessible from anywhere on any device as long as you have internet connection. You're able to work individually or collaboratively on scenario development, even while away from the simulation center. And then you're able to intelligently schedule and manage your resources and run into in situ sessions, excuse me, anywhere from just a monitor, a tablet, or a smartphone, as shown here in the bottom photo. And then there's automatic tracking, and then you can utilize graphic reporting to measure clinical simulation training impacts. And then second, we have the SimX. So SimX is the world's leading virtual reality medical simulation platform of patient simulators specifically for nurses, physicians, and first responders. And then it is a multi-user virtual reality training medical training device. So it enables one to be in the same room, or you could be across from each other or across the world. And then what this one specifically focuses on is that it allows students, instructors, and observers to work together in the same virtual cases. And that's shown here on the top photo. And then what we see with both of these virtual realities is that they develop a virtual reality simulation that is ultra realistic. So if you could even think of the robots movie that came out a long time ago, or even Avatar, it is kind of like being immersed in that type of situation. And then also they have adaptive learning practices, and they use IA, or artificial intelligence, as we've talked about in class multiple times, and that's shown here in that middle photo. And also a voice to deliver simulation. So as most of us have iPhones, of course, you know what Siri's voice sounds like, or if you even have an Alexa. So it is similar to that, and it's the most immersive and interactive experience a provider could have. So it's almost close to the real thing. And healthcare professionals mostly use these platforms to perfect critical skills and competencies. And these can include anywhere from communication, teamwork, decision-making, and critical thinking. And again, they both offer real-time assessment and tracking, and are very flexible, as they could be used remotely and use non-collocated training. And then what I think is the most fun part is that you're able to create custom simulated patient encounters. So you could really make it your own. Thank you. And then, so where are these technologies being used today? So actually, they're being used in many different realms. Some include, of course, medical training, as we've covered thus far. And this includes many different health professionals, but of course, doctors and training and students. And then patient treatment, and then also pain management, physical therapy and rehabilitation, addiction, fitness. You can't see the picture right now, I'm covering it, but I'm sure many of y'all have tried the boxing or even bowling games with the VR technologies, and then medical marketing, and then education for people about diseases or any medical conditions or processes, of course. So now I'm going to go ahead and pass it on to Berdith, and she's going to be talking about that these technologies have in medicine.
So I wanted to discuss benefits in medicine, since most of us are here to lead into a life in medicine. So virtual and augmented based simulators allow residents and attendings to practice technical skills in a low risk setting. So basically, you won't have to worry about a surgeon just practicing on you while going blind. More confidence is built, improving their understanding of operative anatomy and enhancing surgical techniques, less room for error during complex surgeries, less experience doctors will have the ability to watch surgeries take place from the perspective of other surgeons. And so with that, they'll be able to rewatch the surgeries over and over, or the doctor can actually, while there can be an actual doctor there virtually actually guiding them to say, hey, these are the steps, this is what you can do, and this is how you can improve. And then improve communication between healthcare professionals and with the patients, and to educate, patient care and education. And right here, you could see, a doctor is administering a vaccine to a child, but he has a VR headset on. So the child is not right now in place at a doctor's office. He's just somewhere else. So this can help ease him while he's doing that. And then right here, you could see a doctor, giving instructions on the heart anatomy. So with ophthalmology, ophthalmologists are now taking an advantage of SE as a surgical stimulator, and here is what SE looks like. SE Surgical is a high-end virtual reality stimulator for intraocular surgery and training. So it's lifelike environment. It uses a patient model head, which can be operated from a temporal or superior position, and taking the patient out of the learning loop. Residents can practice on their own or with guiding and training, and can be available at any time. So with this, since the eye is a very sensitive organ, so it's, I guess with the Etsy, it's more easier, so they could practice more and really be able to fine tune their skills before they go in blind. And so immediate feedback and long-term skill monitoring. So when you use this Etsy, as soon as you're done with using it, it actually gives you like a grading scale of how you did, what you could do to improve it, and fewer complications in intraocular surgery, and practice all the key stages of intraocular cataract surgery. So with neurosurgical training, so right now, more neurosurgeons are actually needed in the world. We actually do have a problem. So training in neurosurgery is a healthcare emergency due to steep learning curves, expensive programs, no stimulation-based certifications, and limited access to the cadaver dissections. And so right now they have Upsurge On Academy. It is made by neurosurgeons for neurosurgeons. So the Upsurge On Academy is an integration of the three project products, where it uses apps, augmented reality, and BrainBox into a single high-tech education program designed to support anatomical knowledge, surgical skills, and procedure ability. And these same technologies will soon be available for surgical spine surgery, ENT, maxillofacial surgery, general surgery, and many other specialties. And so with COVID-19, during the isolation of individuals at home during the coronavirus pandemic, it gave rise to new technologies of virtual reality. So when everyone was quarantined, most of the time, they did have individuals who were engaging in virtual travel with their families. So even though you were at home, you were still able to do other things with your families. So you can create experiences, and you would still have be talking to your actual family members. And so with that, and a 360 video as a V-powered production technology, and could immerse in storytelling, and virtual stimulation were also used to educate the public on COVID-19. Like right here, it shows individuals infected, individuals who are vaccinated, and individuals who are not. So this was a tool to help the public to actually get vaccinated. So for future implications, right now in the market, for 2020, it was projected $10.85 billion. And then by 2028, it is projected to be $52.3 billion. in the market. And so for augmented and virtual reality devices for the future, it will continue to be personalized, accessible, and designed to have a better experience. And we can see that more in the future, it will be implemented in all medical schools for educational purposes. And here are sources.
That's right. Yes, okay, so can you elaborate more on the cataract surgery of, like, the cataract side of virtual reality?
So I don't really know exactly what goes in depth in cataract surgery. I just know that this tool is used to actually help. It actually has the same steps that you would use for cataract surgery. That's what this tool helps, doctors and future residents know how to, do. That's what I got on the website.
So you know, like, well, we currently still use this when you're learning to operate and be really precise with your instruments. They do like peeling of the skin off of a grape and stuff like that. This gives you like the same thing, except you're actually getting to see like the actual eye in there, projection of cataracts, the ability to use your tools to seem like you're removing that, so that when you actually do that on the real surgery day, you've done it plenty of times in a virtual setting.
Looks beneficial.
Can you
It's
guys repeat the
yes.
questions as well, just so I can hear them on my end?
She was asking about for us to explain more about like the cataract surgery use of this
Oh, okay,
machine.
okay. Yes, okay, so yes, you guys did a great job already describing that. Yeah, it's just hard for me to hear the class. Thank you.
Any other questions? Huh? Oh,
So, actually, medical simulation and everything has been going on in medicine for many, many, many years.
Yes.
You get trained on nursing school, medical school, actually even in accreditation for nursing schools, they actually get credit for rotations on simulators. They have not done that for physician rotations. You still have to go into the hospital. But these are training programs that are well used. We've designed some for geriatric stuff with virtual reality, where you go in and you do like a home assessment for geriatrics for at risk. I designed 10 or 20, set up the lab at Nova. I mean, this is kind of a big thing now for training students. What I'm wondering about is, what is it gonna look like in the classroom? Are we all gonna have, I mean, I like the idea of the kid getting the shot, but I would like to see that virtual reality when I go to the dentist, because.
They probably will have that.
Yeah.
I need one of those virtual reality, the music and the high decorations on the ceiling are not cutting it. But, I mean, do you envision education changing so much that instead of sitting here looking at each other, we would be all wearing goggles and like doing this in our class?
I could see that.
That's the idea for this technology to be implemented into all forms of education. And in this case, not even just in the medical setting, but maybe in schools,
Yeah.
high schools. One of the technologies is being used for like military training and stuff like that.
I
So,
mean, just imagine how much better they could drive in Miami if they actually.
Oh my
learned how
God.
to drive.
yes.
Yeah.
And actually, Dr. Perez, with her urging, we bought the program Body Biz, which is the anatomy one. That's the anatomy virtual simulation, so that you can do anatomy again. We didn't hear about it till anatomy course was almost over, so.
I've been pushing for that.
Yeah.
So it's here to get a virtual simulation
Yeah.
while they're taking the anatomy course. Although I don't give the anatomy course, Dr. Vidal does. But I have given the anatomy course here before Dr. Vidal started working here.
I didn't make big.
So I thought that would just be very helpful, and unfortunately, we didn't get it in time for you guys, but we will be getting it this year. So let me
Oh,
ask you,
that's
what
awesome.
did you guys like the topics that I gave you guys, right? That it, out of the box, right? Out of
Yes.
everything we're doing. Did everybody enjoy that, or some of you were like, oh, this is boring, you know, say?
I like it. If you
You're
said
okay, Louise?
Definitely far from boring.
I think it's the kind of thing that your generation is gonna deal with. This is, your kids are gonna be educated like this. When you get to medical school, you're going to see, I mean, we do it a lot at the hospital. We have whole simulation centers. They have whole hospitals that are all simulators that residents and physicians rotate through. For continuing education, they do that. I mean, imagine, I mean, this is not cutting edge anymore. It's just taking it even further than we envisioned.
Absolutely.
And it really came out of, do you remember the the FAA? And this really came from pilots learning how to fly
Right.
Right.
and driver's instruction. That's really when it first got going. And then they realized that it could really spread. I mean, to me, this is gonna be the way that we educate in the future.
Absolutely. Yeah. All right, that was excellent.
Marlon.
Now, I know this technology is supposed to enhance medicine, but what happens to your local physician who's at the corner, doing family medicine or the small hospital, the older physicians? Do you think this will replace?
In some aspects, yes, and it already has been, and it's, like I said, the pushback, one of the constant pushback from the educators and the providers right now is a lot of people are being driven to retire because of the updated technology. And oh my gosh, I have to learn one more thing. And oh my gosh, I'm just not young and able to learn this technology like everybody else is. So it does push older and more traditional practitioners out, but I mean, we're never gonna do away with that, just like we're never gonna do away with the classroom setting, and go completely virtual, anytime in the near future. Same with hospital settings. So, Dr. Perez mentioned before that you have to be really, really good to not be pushed out by this technology. Make sure that you are good enough to where a robot cannot replace you in the field.
Yeah, and I just want to add to that. I don't want you guys to be, because, okay, different generations are gonna see this differently, because like Marlo and I didn't grow up playing virtual reality. Maybe your little brother's already playing virtual reality, or one of you are playing virtual game, you see? But we weren't doing that when we were children. But this is this is what I want you to take home with you. Don't be afraid of new technologies coming up. Everything has advantages and disadvantages, right? I talked to you about that before. The more emotional maturity you have, you realize that the world is not black and white. It's all gray, right? So don't be afraid of new technologies, but what you do have to do is welcome them and learn how to use them to your benefit. Those are the people that are gonna be successful. You see? So like, right, I'm gonna tell you about me. What have I been doing right now? Learning how to use ChatGPT. Why? Because everybody's afraid of ChatGPT, but it's going to be used. So who is going to be asked for jobs? Not who knows how to manage ChatGPT the best. That's the person who's gonna get the job. You see? The technology is gonna be there, like all these technologies. The idea is that you learn how to use them properly. That's what's gonna keep you in the game.
Yes,
For
and I
the
kind of
small
wanted to chime on to that, Dr. Perez, just because, I mean, just experience wise, obviously we all lived through COVID, and that's still a continuation. I know COVID is still a thing, but you know, you have to adapt and you have to adjust accordingly. It's kind of like a sink or swim situation, because no matter what, things are always going to be changing. And so, just like Dr. Fred said, it's going to be between two people who has the education on this and maybe who doesn't. And since it is something that's expected to excel in the future, they're going to expect that you have that education.
The issue for many of the small practitioners, Marlo, is not so much not wanting to learn the technology, it's the cost of putting that technology into a small practice. So I think what you want to see, you know, you have 80 million outpatient surgery centers. I think what you're going to end up needing is opportunities like that where, you know, capital investors build a center and family practitioners could use that center rather than having to have all of those expenses in their practice. Or you're going to have to find a better way to fund it. Insurance companies, instead of making bazillions of dollars of profit off of the doctors, which they do now, they're gonna have to feed back some of that money into their practices. You know, Dr. Ahmed, for example, I mean, he has hired younger physicians than him, and they bring those skills. But bringing those skills, it was like when they converted to an EHR. How many small physician practices can go into debt $200,000 to $250,000 for an EHR system? To log the very same stuff they've been logging all along. I mean, that therein lies the difference. So it's, what are we going to do if we want to keep small businesses and small practice going? What is our role going to be in financing some of that adaptation or making the tools available on a parental basis or something? Maybe we should, you know, invest in a company that has all of these tools and we just run them out. Who knows?